Namaste. Hi, this is Hemant Vanjari presenting the video on adrenal gland. The learning outcomes after watching this video you have to idea about the adrenal gland and the hormones released through the adrenal gland. Then the introduction adrenal gland. The pair of adrenal glands or the suprarenal glands lies superior to the kidneys enclosed within the renal fascia. They are about the 4 centimeter long and 3 centimeter thick. The adrenal glands are composed of outer layer of adrenal cortex and the inner layer it is a medulla or the adrenal medulla. The adrenal cortex produces a total about 40 different hormones which are collectively known as corticosteroids. The complete loss of the adrenocortical hormones leads to death within a few days of a week due to the dehydration and electrolyte imbalance. The adrenal gland are composed of two pairs with having a different structures and functions. The outer part it is a cortex and the inner part it is a medulla. The inner adrenal cortex is essential to life but the medulla is not. This is an image of adrenal glands which presenting the locations of the adrenal glands as well as the layers are present on the adrenal gland. Then the adrenal cortex having the three different layers: zona glomerulosa, zona fasciculata, and zona reticularis. The adrenal cortex is the outer region and longest part of the adrenal gland. The adrenal cortex produces the three group of steroid hormones from the cholesterol, that is adrenocorticoids or the corticosteroids. These groups are glucocorticoids, mineralocorticoids, and sex hormones, that is androgens. The hormones in each group having different characteristics action, but as they are structurally similar, their action may overlap. Then what is the reflection spot? Just think on it. What is or what are the functions of hormones which are released from the adrenal gland? Then different types of hormones which are releases from the adrenal glands with its function. Then the adrenal cortex releases the three different types of hormone. First one is a glucocorticoid, second one is a mineralocorticoids, and last one is a sex hormones. That is, then first one is a glucocorticoid. The function of glucocorticoids it is a raise in a glucose level in blood, stimulates the glucose production by cells, reduce the inflammatory responses. Then mineralocorticoids it act on the distal convoluted tubules of nephrons, regulates the uptake of sodium and acid base balance. Then sex hormones they very small quantities, adrenaline and noradrenaline, fear, flight and fight syndromes. Glucocorticoids, cortisol, hydrocortisol is a main glucocorticoid, but small amount of the corticosteroid and cortisol are also produced. Commonly, these collectively known as steroids. They are essential for life, regulating the metabolism and responses to stress. It is stimulated by the ACTH, adrenocorticotropic hormone from the anterior pituitary and stress. Glucocorticoids having an anti-inflammatory action. Mineralocorticoids, aldosterone is the main mineralocorticoid. It also involved in maintaining the water and electrolyte balance. Sodium reabsorption is also accompanied by the retention of water, and therefore aldosterone is involved in the regulation of blood volume and blood pressure too. The reabsorption of sodium by the renal tubules and excretion of the potassium in the urine. Blood calcium levels regulates the aldosterone secretion by the adrenal cortex. When the blood potassium level rises, more aldosterone is secreted. Low blood potassium has the opposite effect. Angiotensin also stimulates the release of the aldosterone for maintaining the blood pressure. Then aldosterone maintaining the blood pressure by the release of the renin enzyme through the liver. Then sex hormone secreted by the adrenal cortex are mainly androgens. Male sex hormone, although the amount produced are insignificant compared with those secreted by the testes and ovaries in the late puberty and adulthood. Then adrenal medulla. The medulla is completely surrounded by the adrenal cortex. It develops from the nervous tissue in the embryo and it is a part of the sympathetic nervous system. When stimulated by the extensive sympathetic nerve supply, the glands release the hormones. About the adrenaline, it is about 80% and noradrenaline it is about 20%. Adrenaline and noradrenaline. Noradrenaline is the postganglionic neurotransmitter of the sympathetic division of autonomic nervous system. Adrenaline and some noradrenaline is released into the blood from the adrenal medulla during the stimulation of the sympathetic nervous system. The action of these hormones prolongs and augments the stimulation of the sympathetic nervous system. Conclusion. Adrenal gland release the different hormones from the cortex and medulla layer. These different hormones regulates the different function like as a regulation of blood pressure, reabsorption of sodium and water, and also it maintains the sympathetic stimulation, that is flight and fight mode. References. Thank you.